Bhalashruti of yoga. When you read some Bhalashruti of yoga, they might have written so many things. It will do like this, it will do like this, especially some Dasayana yoga and all. You will have so many indications. But when it comes to the reality, it may be a little bit different. This also applicable in the context of the topic what we are going to speak is about the Snehana and the Svedana. So what I am going to speak is about Snehana and Svedana, and the organization has given me the title also that Kerala Speciality Therapies. So I have to add something more about why this type of treatment has been much popular in Kerala. Of course, it is also popular in many other part of India too. But geographically, Kerala had some advantage in terms of the climate, in terms of many other things. Because of that, a lot of books has been arrived too, based on Kerala Chilsa Kramam, starting from the one of the oldest book in English, Ayurvedic Treatments of Kerala by N.S. Moose in 1940s. So the traditional practice of Snehana Swedanam was also become a significant role to play, because most of the time when you look into the classical Samhitas, when dealing with the Chikitsa, the whole Chikitsa Sthanam starts with Shodhana Chikitsa. Whenever you start reading any Chikitsa Sthanam, any chapter of Chikitsa Sthanam, especially for example if you take from Ashtanga Hridayam, Chikitsa Sthanam starts with some Snehana, then Svedana, followed by Shodhana Chikitsa. Pandavama Epi Vedado, some Kalyana Gahvayam, etc., etc. Then you do Amana or in the Tiktakam, in the Kushta Chikitsa, you see Padaladam Pagaduga, Davi Padadura Laba, like Tiktakam indicated. Later on, they'll speak about Vamana, Virajana, like that. So, classical textbook try to communicate that we are expected to do more and more Shodhana, but in reality, when you come into real-time practice, Shodhana Chikitsa has a lot of limitations, because when you categorize them in terms of Yogya and Ayogya, the minority people only falls on the Yogya, fit to undergo that. A majority may falls into Ayogya or unfit to do the thing. And such situation comes, what would be our options? There is a condition where we really need to mobilize the dosha from the site of lesions, from the site of elimination. We have to mobilize dosha from the point of some location to another location. We have to remove that things, but again, the person is not really fit. So probably there is a need of identifying some technique by which we, not really like a classical Shodhana, but that could be able to purify, that could be able to clean the Shodas or the Shoda Shuddhi, that could be able to minimize the Ama, that could be able to ignite the Agni the best as possible. And keeping on that idea, basically Snehana Svedana came into the limelight. Basically when we say about Snehana Svedana, we have a notion that okay, we are applying some oil on the body, or we are keeping a person into a steam bath chamber. No, these are some very superficial norms of it. The idea of Snehana Svedana come from the first chapter of Ashtanga Hridayam till the last chapter of Ashtanga Hridayam. Because while speaking about Tailam Khridam Madhu, Tailam become an important thing, and that Tailam will become important in Vadasyopakrama Sneha Sweda Samshodhanam Madhu comes there. Then that will become important again in the Chikitsa Sthanam Kevalam Nirupastamba Madhu Sneherupachari, like that. The same one line will be multiplied and it become like a metastatic nature will happen from the first chapter to the last chapter, reaching to the whole structure, all the anatomy of the Ayurveda. So coming to the point, what I want to say is that the Snehana Swedana generally considered as a preparatory method for any Shodhana. So generally we call it as a Purva Karma, something that which you do to prepare some major treatment. But not necessary to be always like that. The same Snehana Swedana can also act somewhat nearer to the Shodhana, or at least a mild to a moderate level of purificatory effect indirectly can be achieved. While telling this idea, when Shakham Muktva Malam Koshtam Yandi Vayoscha Nigraha. So while managing, when the mobilization of the dosha happens, Acharya says that Vrithyat Vishyantanat Pakat Shodhomukha Shodhana Shakham Muktva, living from the Shakha, Koshtam Yandi, Koshta can be any place. That context, Koshta doesn't restrict it to the gastrointestinal tract. It can be a place where nearer to the eliminatory area. In that perspective, Bahiparimarjana Chikitsa, we can call it as Andaparimarjana and Bahiparimarjana Chikitsa. A Bahiparimarjana Chikitsa can also be a very strong and a very effective tool by which we could be able to achieve a large things. That is a very criticality which not directly mentioned in the classical book, but we could, over a period of hundreds of years of practices, Ayurvedic clinicians were able to achieve. When you look in the clear-cut classical Samhitas, you never get so many details of these type of therapies of Snehana Swedana. Of course we have. Whereas we have chapters for Vamana, we have chapters for Virechana, we have chapters for Vasti, but we don't have a chapter for Kaya Sekam, we don't have a chapter for Pinda Swedam, we don't have a chapter for, okay, there are Lagana Brahmaniam is there, or in Charaka Samhita we have Upakalpaniyam is there. There are some chapters where we get the classifications of this, but details are not mentioned. But over a period of time, that has been evolved, that has been practiced and made into a concrete form and made into the so-called thing. So what I want to highlight in that point is that we are what Ayurveda practices now as a Snehana Swedana, not only as a Purva Karma of Shodhana Chikitsa, rather it can be an independent treatment subsidiary to Shodhana Chikitsa. There are people whose disease are fit for Shodhana Chikitsa. We have a psoriasis patient, and this psoriasis or that skin manifestation, Ega Kushtam or whatever you name it, and it is that disease condition is Prabhuda Dosha Avastha, it is fit for Panchakarma, fit for Vamana or fit for Virechana. But unfortunately, patient is not fit. Maybe patient had a Hridroga, patient is having some other diseases. Because of that, patient is unfit. So at that condition, are we what we able to do? Then we can do a Takradhara, a Takram made out of Arabudhadiganam, and whole body is poured with a Takram, and excellent result can be achieved as equal to, not really equal to, but it can bring wonderful result in the same patient who is actually fit for Shodhana Chikitsa. That's what I want to highlight in this point. So this type of interventions, these type of inventions are largely made in Kerala. Because of that, it is called Kerala Chikitsa Krama. It happened to be because of three things. One is the climatical advantage, because plus 20 degree to plus 40 degree most of the time, even in summer. So the climatical advantages makes that state to practice well, and also the plants availability of drugs. It was very easy to identify the herbs, and 30 to 40% of the geographical land is being occupied by forest. Made freshly available plants was another advantage, and there was also a lot of people who was really practicing to, in the core of Ayurveda, made this practice into popular. That is why the Kerala own treatment formulations like Shashtikashali Pinda Swedam or Kaya Sekam called Pidichil or Tadaval Urinyu Tadaval, there are different things which I am coming to the point where, and also become a popular practice, kept in the popular practice among the people, especially like in a Karkadam month, like in Varsha Ritu starts, Vayo Grishmadishu Tushu Varshadishu Pittasya. So when you have Vada Pitta situations and all, It is there. And when we come into the Chikitsa Kramam, a proper preparation of the patient is also very significant role to do, and administration of the proper Chikitsa and care after this. This is a basic thing every treatment we need. So we have a Purva Karma, maybe a Pajanam, Dukshanam, Deepanam. Then we can have a Pradhana Karma, like it may be a Kaya Sekam or a Pirichil, or it may be a Shashtiya Shali Pindasodam. Against this therapy can also have a Purva Karma and Paschat Karma, that is Patya Bhatya. But those Patya Bhatyas are absolutely little or not Kashta Bhathyam, it is Sukha Bhathyam compared to the Shodhana Chikitsa. Most of the Shodhana Chikitsa we have Kashta Bhathyam, means we have a tough regime to practice. But whereas we have, when Kerala Chikitsa, we have a Sukha Bhathyam. That means you have to follow something which is very simple to that. And fundamentally, when you look into the Panchakarma, many people have thinking that how come this Panchakarma word come? Basically, if you look into the Kaya Chikitsa, Charaka Samhita, you don't get the word Panchakarma. And if at all they told Panchakarma, then there's something else called Agunjanam Prasaranam, that is another Panchakarma. Here in the context of Chikitsa context, Panchakarma word is not there. Charaka describes Chadushpragaro Samchuddhi, Pipa Sadapamandi. Chadushpragaro Samchuddhi. What I assume that, it's not there in the classical book. What I assume that Panchakarma might have been word come from Pancha Mahabhuta. So all Panchakarmas are Pancha Mahabhuta Shuddhi. Basically, we are made up of Pancha Mahabhuta. So Navakaraka Drivyas, Kaladika Atma Manas, 4 things, then 5 Mahabhutas. So we are all 9 Drivyas are there, we all have. If Atma is not there, then your anatomy department people will take you because they want a cadaver for that. So otherwise, Atma is there, not there, Manas is also not there. If you are 7 Drivyas, Kala and Dikki is not there even when the person is dies. So only Pancha Mahabhuta is there, then cadaver is needed. Otherwise, if you have 9 Karana Drivyas are there, then look into the Mahabhuta level. Think in that level. So if Pancha Karmas are related with Pancha Mahabhuta, each karma has a special affinity to purify one Mahabhuta. Look at the Prithvi Mahabhuta, look at the Nasya. Nasya, how come related with Prithvi? It is. When you really deeply study Nasya, you will identify the role of Nasya. In Garbhani, that is the only Panchakarma permitted to do is Nasya. Shmadhishtaya Jayade. Shmadhishtaya Jayade. The Pumsavana. Shmadhishtaya Jayade. Prithvi. Jalamahabhudam. If you want to purify your Jalamahabhudam, Vamana is excellent. That is why whenever we have water retention related diseases, even new generation issues like hypothyroidism, you do Vamana, you get very good result. In obesity, you do water retention is too much, you do Vamana, you get very good result. PCODs, you do Vamana, you get very good result because there is a relation of Jala Mahabhuta. Videjana with Agni Mahabhuta. It is self-explanatory, you can imagine of it. Anuvasana Vasti with Vayu Mahabhuta and Niruha Vasti with Kashaya, Niruha Vasti with Akash Mahabhuta. Then Uham. Uham is something that which cannot be imagined or which cannot be predicted. So Panchakarma word, even though it is not directly told, probably this Panchakarma in Andha Parimarjana framework, we have 5 Mahabhuta in one side and one side we have 5 Panchakarma. Look at the other side also. I just put some Bahi Parimarjana Chikitsa for your curiosity of interest. You can think over, there may be some difference of opinion too. I put Shirovasti like Uddhvartanam like a treatment, Takradhara and Dhanyamladhara like treatment, which has a great role in the Jala Mahabhuta. But it can do many other things also. Kshiradhara like Navarakiri like treatment, which you may be surprised to see that Kshiradhara for Agni. Yes, Navarakiri or Shashtikashali Pindasvedam is another thing. Tailadhara Pirichi like thing. That is why Kevalam Nirupastamba Madho Snehe Rubal Sapir Madhya Avasatailam. So Tailadhara Pirichi like Kayaseka like treatment on other side for Vayu. Talapodichil like treatment like Talapodichil Avagahan type of treatment which has a gross role to play in Akacha Mahabhuta. I am just putting this a thought for your igniting your idea. It's not told really in the classical book, but if you think in these type of dimensions, you will get a better idea how things are working. Hmm? Not only in the framework of dosha. There are so many situations we can go into the deep of beyond the dosha. Bhude Bishchanad, Adichinta Chikilside, Shushra says no. Bhude Bishchaparam, Adichinta Chikilside. So you can go even up to the thing. So this point I want to highlight that it has also Mahabhudas. Another thing we should remember is about the guna. Whole therapies are basically meant for creating a change in the profile of the guna. That is the fundamental basic. 20 gunas basically has 20 karma, and we are making a permutation combination of these guna in therapies. So if Guru Guna Pradhanam is there, then it's called Brahmanam. Yasya Brahmane Shakti Tad Guru. Yasya Brahmane Shakti Tad Guru. Yasya Langhane Shakti Tad Lakhu. Yasya Snehane Shakti, that is Yasya Snigdha, that is Snigdha. So like that. Yasya, like that. If you take each guna predominantly, that will become one karma. Out of these guna, we take 6 gunas, and that 6 guna converted as 6 karmas and adding with other gunas. So we have Langhana Brahmana, then we have Snehanam Swedanam, then we have Rukshanam and Stambanam. These 6 karmas are, Shida is called as Stambana. So we take 6 gunas and 6 karmas we take, and that has been described. If you go to the Charak Samhitas, you will get those 6. But there are possibility that you are able to make use of, there are possibility that we are able to make use of more than the 6. That means at least we have a possibility of 20 guna in the karma level. I hope you are able to follow me. So this is the skeleton on which the whole procedure starts. Whenever we do a treatment, this is again, I believe you are all at least final year students or the house surgeons, PGs, right? Am I right? Final year students or also first year students? Second year students, okay, fine. There may be, whenever you are working in a hospital also, when you try to understand Ayurveda also, it is be very remembered that what is happening inside the body has to be understood from base of Ayurveda. Imagine you are an RMO of the hospital. You got a call in the midnight. Doctor, that patient is getting headache, patient is complaining headache. So you give some medicine for headache. Based on what? You are not supposed to give a medicine until otherwise you are able to identify at least 3 things to know. Whether that Lakshana, that Shirashula is a Lakshana of Pradhana Vyati for which the patient has come. Second thing, whether it is a Dosha Sanjara Lakshanam, patient is undergoing Nasya. This is the second day of Nasya. First day he has been given Nasya. And he has, that lady has already spit out a little bit, but doesn't spit out properly, put air conditioner in the room and slept in the night. And midnight you will get a call because there are Utklesha, doshas are Utkleshanas happening, getting headache. So, Kriyakrama Lakshanam, Dosha Sanjara Lakshanam, these 3 things at least you should know. What is Dosha Sanjara Lakshanam? Doshas will mobilize from one place to another place. Patient will say, I have pain here. Tomorrow patient will say, I have pain here. Sometimes patient will say, sir, I have pain today here, tomorrow here, then yesterday here, today here, maybe I believe day after tomorrow here, then it will go. They'll think that hand is like a tube, it's going like that. It's not like that. It is a dosha sanjara lakshanam. Doshas are moving from one side to another side. Sometimes if it is a psychogenic also, but we have to analyze that also. So, dosha sanjara lakshanam, by dosha sanjara lakshanam, you are able to analyze, okay, these are things are happening. It's not that, okay, patient is selling headache, you give some pill to the ill. No. Try to understand at least 3. I'll repeat. One is Pradhana Vyati or the Vyadhi Lakshana. Second is Dosha Sanjara Lakshanam. That means the mobilization of dosha from one side to another side. Third one is Kriyakrama Lakshanam. You are starting a Kriyakrama. So, for example, when we start a Dhanyamala Dhara on the body, patient had 3rd day, 4th day, 5th day. 4th and 5th day, patient is telling, sir, I'm not getting sleep. Can you give some pill to sleep? Then Armo had to ask what treatment you are getting. I am getting Dhanyamladana. How many days now? It is 5 days. How is your joint? First few days I was feeling better. Yesterday onwards my joints are not so good. How is your bowel movement? It was well good, but now yesterday I didn't pass well. Vadanvyomyam deeptagni snigdhavarcham asamhadam yukshe viparyaha. All the sammik snigdha lakshana, you put it in a reverse, you will get sammik dukshan lakshana. And if you are asking the patient all those questions, you will be able to know that this symptom, the person who is not getting sleep is because of the vata prakopam due to the dukshanam, that's why he is not getting sleep. For which you don't need to give any Swapna Sudha tablets. You don't need to give. You don't need to give. It is because of the vata prakopam of the treatment. It is fine. So you convince the patient. You may give some Chirabala 101, apply on the head instead of giving Swapna Sudha. You may give. If you are able to give that type of administration, because it is a Ruksha, you are going to give some Snigdha, then you will become Ayurveda. Otherwise, it will not become Ayurveda, okay? Giving a pill to an ill is not Ayurveda. Abhyantara Vikriti Parampara evam Vyati, tat chikitsa. Abhyantara Vikriti Parampara, you are able to know the whole drama happening inside the body. And if you are able to understand the drama, you know how to play the role of it. That's the point. So, for which this treatment. Because of these reasons, now when we speak about different therapies, you have to keep it in mind that we make different type of combinations of this type of guna. Okay. So, how to do Purva Karma? Purva Karma can be many things. First of all, if you want to looking for a treatment, for example, you are doing a Snehana, fundamentally we need few things. At least the person should have a good Agni that could be creating a good receptibility of the situation. So we may give a Gandharvastadi Kashayam, or it may be Chiruladi Kashayam. Why I have written Chiruladi Kashayam, you may be having confusion. Right? Gandharvastadi and Chiruladi, there are only one herb is different. Gandharvasta Chirulapana, Dashavilla, or Chirulapana, Bhaya, Kanamagara, Saito, Pakujalam, you put it in the two list and you compare, there are only few differences are there, even the indication is different. Then, or you give Vaishkala Churnam, or you give some Panchakola Churnam. Idea is that few things: ignite the Agni, minimize the ama, and maximize or clean the sotas as best as possible. Not all, as best as possible. Because anyhow the disease will have its own sodo, rosatwa is there, that will be there. But you create a situation that everything is fine. At least it can start working it. Then, or it may be given like a takram, giving a takram. Takram laku ashayamlam deepanam kaphavadaji. So deepana effect is there. It is a very common practice, having a buttermilk is a very good thing. Then you may go for different therapies. It may be a Patrapotali Pindasvedam, or it may be Shastika Pindasvedam, whatever. I just put some examples of it here to give an idea of these therapies. Now, what actually does these therapies? That's what I want to highlight again. That basically, all these therapies, basically Sneha Sodhana, basically supposed to do Sodo Shuddhi. It is also done by Vamana Videjan and all. Yes, but the difference is that when we have in the Dhatus, from Dhatus to the Koshta, there are innumerable Shodasas. Sthula Shodasas are numerable, but innumerable Shodasas which may be blocked, which may be misbehaved, which may be not under performance, has a possibility to get better by that. And proper Mala Nirharanam, again here, Mala not restricted to the word Purisha Mutra Sweda, other things also. And it can act as a Brahmanam, depends upon therapies. It can also act as a Shamanam in different situations. Sometimes it can act as a Utklesana treatment also. Utklesana in the sense you mobilize things and expect it to be eliminated in the different locations. Again, the purpose of Mala, Shakha, Marma, Asti, Sandhis, there are other places also. The problem is that in Ayurveda, when we started in Ayurvedic college, the biggest challenge is that the first day we will be taken to show to a cadaver room, anatomy room. This is a fundamental mistake we will have. Because if you have been taken to an anatomical cadaver room and you are going to study the anatomy, Ayurvedic anatomy is something very different. Ayurvedic anatomy is not with the structural anatomy. Structural anatomy is its own way. Ayurvedic anatomy starts from a Kaumarapatya or the Prasuti department. The student will go there and the couple will come and they will say, my wife is pregnant now. So from there, Shukrashavanadam Garbhajyastam Atma Prakriti Vigarsam Murchidam Garbhatijit. Sharidam starts with Garbha, not cadaver. Ayurvedic anatomy is not cadaver dissected anatomy. Ayurvedic anatomy is embryogenetic anatomy. You start from embryo, how from embryo grows, how things are, just like from a seed, how whole tree are happening. So everything is there in the seed which has been expanded in a peculiar way. So embryogenetic anatomy can be different from a cadaveric anatomy. Keep it in your mind. Cadaveric anatomy means what you see things as it is structurally and trying to relate things. That's fine. Nothing wrong in that. But embryonic anatomy is more functional. It can manifest as a structure which is more functional. At the same time, there are things which is beyond our observation, but beyond, it can be understood indirectly, which is called Anumana, Upamana, etc. things. So keep that in mind, otherwise you will be in a confusion. The moment if I say Marma, the moment if I say Shaka, Asti, then remember that Ayurvedic anatomy is something very different, which could be very useful if you misunderstand that anatomy. In the studying of Ayurveda will become very much difficult, especially when it comes to treatment. For example, patients say Shakha Muktva Malam Kostam Yandi. Then we say Kosta, translated as gut, GIT. It's not necessary to be. You are doing an asya and material come in different part of the oropharyngeals and different other pages. It's not a GIT. It's not necessary to be GIT at all. So, the terms what we use are the words which is express and function, expressions of functions, not of the structure. The place where ama situated is called amashya, not the other way. Ama situated place is called amashya. Ashaya for ama. It can be anywhere. Not the stomach. Stomach can be amashya in situations, not all situations, but amashya fundamentally means a place where ama resides. It can be anywhere. So you understood what the difference between the structure as well as the function. Both are very much different. Day-to-day situations also, we use a lot of this structural function thing. If you open your computer, you have a hard disk picture, you click on that, you will see C drive, D drive, different drive. If you take your computer outside and hard disk, you break open. Do you see these partitions, compartment in the hard disk? Will you see that? You never see that. Will you see that? Do you remember? Can you show me? You cannot see that because that's a compartment, is a functional compartment based on our understanding we created C drive, D drive and all. It's just a functional compartment. In everyday life, we commonly use it. Similar way, if you understand that idea, you'll be able to understand Ayurveda also well. So keep it that mind, all Kerala Chikitsakramas are not Brahmana. Again, there is a wrong notion that the Snehana Svedana Chikitsas are all Brahmana. Not necessary to be at all. Helps to eliminate doshas from the kosha. Maybe it can create some vasodilatation, it can increase peripheral circulation. There are so many other added advantages are there, especially tension of the muscles, etc. Promote the functional ability of the nerves, microcirculations of the brain, very importantly. Medication to help improve sensory perception. That is why Indriya Shuddhi has been described. Again, there are general pathyas also there. When we will come to one by one treatment, there are specific pathyas also there. Just like in a Snehabana Adhyaya, Ushnota Gopajari, Brahmajari, Shabasya, like that. Usage of hot water for all things. Brahmajari. What is this Brahmajari? We have Brahmajaris, Brahmacharis and Brahmajaris. Those who are, Charya means in Malayalam it's called, you are leaning towards that. So if you are leaning towards knowledge, then you are Brahmachari. If you are leaning towards your mobile, then you are Brahmachari. That's only different. No, that it's not really abstinence, it is about the control of your sense organs. Non-suppression of urges, no exposure of cold, Chabashya, etc. Actually, we have to read lines in between. Then things will be much more easier. Pathya continued further. General pathyas are there. But every treatment will have very, very specific pathya. This is very important. For example, a patient had Tailadhara. Imagine a Tailadhara patient had. So the person had exposed of nearly 3 liters of oil at least for 30 to 1 hour on the head. The gunas of Taila, you remember, Tailam Suyoni Tatra Mukhyam Diksham Vevaicha, Taddoshara Trisham, like that, gunas. Hridat Tailam Guru Sheshtam, it is Guru. And it is a Vata Kapasthanam, your Guru treatment is given, Ushna treatment is given, a set of gunas are under elevation, under brim. And the person is going outside, going for a swimming pool, taking wonderful head bath with a shower or a jacuzzi. Very good. They will get tomorrow next day, nice headache. Because already they made a lot of guna elevations, and if you give add on to that existing gunas, condition will worsen. Very commonly happens in many places. So that is called Vishesha Pathyam. Samanya Pathyam is a general guideline which is supposed to any patient could follow, but every Kriya Kramam will have a specific Pathyam. What is the word Pathyam means? Pather Hidam. Pantha is the route or the channel or the direction on which what you are doing. Hitam, that is good for that. So you are aiming for something to do, and all that person's activity, it may be ahara, it may be achara, it may be vihara, it may be vichara, vikara, whatever it may be, that should not block or should not redirect the direction in which the physician is looking into it. Very, very simple. So Kerala Chilsakramam can have a preventive role, like a Swasthasya Swasthya Rakshanam. It can have a curative, Vyadhi Prasavanam, or it can also promote Thadunam Chabiladu, like it can create Thadu Pushti also. That all the three will be happy. For example, there are Svedanas are there, in the classical Charaka Samhita, we have Sagni Svedam and Niragni Svedam, Sangara Pasturunadi, Parishe, Guavagahanam, that type of Sagni Svedam is there. Vyayam Ushnu Sadanam, Guru Pravanam, Shuddha Bhagavanam, Bhayakrodhadi, like, Abhyandara Sneha, as also. Niragni Sveda is also there. But we are considering mostly about the Sangara Sveda, especially the type of feelings and other things which comes under Potali Svedas and all, on one side. Another side, other treatment which is like labor. So, why we want to do Svedanam? The question is why we want to do, how we prepare it. Basically, Svedanam is indicated when a disease where Stamba Gaurava Shida problem is there. When you find a disease, the Stamba Pradhanam, like in a Parkinson's disease, you have Kamba Pradhanam and Stamba Pradhanam, rigidity. Stamba Pradhanam, Gaurava Pradhanam, Gurutva is there. Person is telling, I am not able to remember things, not able to come, I am not able to grasp things. Prati Mahabhudam is very important for Guru, that is retention of the memories and all. So that is missing. Samba Gaurava Shidakhanam. So wherever you want to, already the person is having Shida Pradhanam is there. Then Svedanam Svedakaranam. Prepare procedure as a Pradhana Karma for the individual patient. Fundamentally, what any Sveda does is it opens up the sotas anywhere in the body, liquefies the doshas, it is able to liquefy, not even really mobilizes in all ways. It at least it will facilitate the sotas. The problem is that in Ayurvedic colleges, when we teach sotas, then we put one line like this, like a pipe, and this is sotas. Not necessary to be like that, not necessary to be like a pipe. We have been taught like that in physics and all because of our anatomical perception. Not necessary to be. It can be like a transmembrane, like in a calcium channel or a sodium channels in our system, which is not like a tube, or like in a synaptic situations, which is never like a tube. So to bring the doshas from interior dhadus, that is what Shakha Muktva, nearest to the external roots. Nearest root, again nearest root only. Skin the nearest root, okay, you are able to pull it out through skin, then it's Parimarjanam. Through nose, then it's Nasyam. Through mouth, it may be Vamanam. Through lower tract, it may be Virejanam or Vasti, whatever. And generally, Svedana elevates Harshadodha Dudastambhayama Kambakrama, which is able to reduce these type of things in general, which you already know. And Madhavam, Sharira Bala, Agni Bala, Ushti, it is supposed to bring in generally in this Sveta. Then you may have doubt. Is it really achievable in one treatment? No. It has to be proceeded with multiple times. It may be 3 days, 5 days, 7 days, depends upon that. Again, it can create a vasodilatation, sweating, it can create muscle relaxation in many situations, relieving the edema in situations. Very good analgesic effect is there. These are some of the things commonly you see. Generally, Swedanam is Pitta Karakam, Vada or Kevala Vadam or Vada Kapapradam. Selectively in Vada Raktam also we can use it, but you have to be very careful. Rarely in Vada Pitta situation, never in isolated Pitta. This is a general notion about it, but we have options like Shashtika Shalipinda Svedam where we have other Visheshas. This is again, whenever you study Ayurvedic books, try to read in between lines. In one context they will say, this is contraindicated. That is mean it's not absolute contraindication. You have to be very cautious about it. You look at the Vasti, contraindication. Pushti Madhumehi Chamase Sapte Garbini. They say Pushta is contraindicated on Vasti. Then when you go to the Vasti Kalpam, you will get a Vasti called Panjadikta Vasti, good for Pushta. Vagbada. How can he say? One side he is saying it is not able to do, another side he is doing. Samanya Vishesha. Think about the logic. Samanya Vishesha. So, Pushta Madhumehi, when you are doing Madhumeha and Pushta people, you have to be very, very careful. That logic has to be remembered. Whenever you read Ayurvedic books, na Shastra Matra Sharino, na Analoji Agama. Don't absolutely depend upon the Shastra and na Analoji Agama. Means you have to follow Alojana. You have to keep on thinking why he has been told like this. So you will get answers within the lines. So we can have Ruksha Svedas, we can have Snigdha Svedas, depends upon type. We have a range of Svedana. From a Valuka Svedam, with a Valuka, or the sand, or Ishtiga Churnam, or like a Tusha, like a husk of the things, like Umi, like in Kerala called Umi, the husk of the outer layer of the rice or even the wheat. Different type of churnas you can use, like Kolabulathali Churnam or Chadahavadi Churnam. There are so many churnas are available in the market. Or it may be Jambiras type of things, Patra Svedas, Dhanya, simply Dhanya powder can be, different type of Dhanya powder can be used, Shaktika Shali. Or so from this side to this side, this is extreme Ruksha treatment to this is extreme Snigdha. Like Kaya Sekam or Tailadroni, this becomes extreme Ruksha to extreme Snigdha. Again, I want to tell you that no treatment is indicated for one specific disease. Rather, it is a gradation from Ruksha to Snigdha and a Laku to Guru or Guru to Laku reverse, or Shita to Ushna or Ushna to Shita. So if you look into a graphical representation, you have all these possibilities from which you try to take what is appropriate to different conditions. Setting up of a Svedana, no windy room, good table like this, heating devices. So you see the table here. I think we can start now the therapies. So you see this type of new generation table. You know, olden times this table were kept in the floor. The whole table, the droni or the called pati, is be kept in the floor, and therapist has to sit in the floor and do the therapy. Can you imagine how tough it will be? He has to sit in the center part of it. His hand has to reach the leg end, at the same time has to reach in the head end. How flexible the patient should be, how the therapist could be. Very difficult. And over a period of time, they lifted the droni into a knee height. If you go to Kottakkal Ayurveda hospitals and all, you see the treatment is done sitting in the stool. The therapist will sit in the stool, so 4 therapists will be sitting on the 2 sides and 2, and they will do sit by sitting. This is easy for the therapist apparently, because he doesn't want to stand. And now the vessel, the table is in the waist height. Probably in the future we will hang the patient and will do, because we are going from the bottom, from the floor to up. Maybe like a preaching, like a treatment, like a car service. Car service like this. Probably because we are going from bottom to up. So there are very specific tables. We can start the therapy parallelly meantime. You know the droni, the table. It has a unique shape, having a slanting from the leg end so that we should have a flow of proper oil. Dhanyamla, whatever the material we use. Depends upon the material you use, it has to run fastly so that it will be collected in the foot end and can be rewarmed and reused. Generally, it is followed with the 7 position: sitting, supine, left lateral, prone, right lateral, again supine, lastly sitting, 7 position. Not all cases we could able to follow all the 7 positions. Patients with a motor neuron disease, patients with the cerebrovascular accident or Pakshagadam may be not able to lay down in all the 7 positions, but whatever the position we can do the procedure accordingly. Proper sign of Svedana, proper sweating, reduction of pain and stiffness, reduction of the cold and chillness, achievement of softness, Mardogada should come. Again, be careful about fainting, dehydrations, vomiting, rashes, burns, blackouts of the eyes can also happen if you are not done properly in a proper setup. If it is have alpamatra asvedanam, aggravation of the pain can happen, absence of sweating can also happen. So there is a treatment called in Kerala called Pisichil. The word Pisichil comes from the squeezing, which is called Kaya Sekam. Traditionally, people were using this therapy for taking a cloth, dipped in the oil and squeeze like this. So that's what I shown in the picture. Nowadays, people are doing with this vessel, the kindi vessel. So there are different types. It may be Pidichin or Pidinya Tadavan. That means you just pour followed by hand movement. Or materials can be different. So you have extreme range of material from extreme Ruksha medicine to extreme Snigdha. One of the extreme Ruksha material available is Dhanyamlam. You know what is Dhanyamlam? Okay, if you open up the Sahasra Yogam, there's a book called Sahasra Yogam. So before starting with Asavarishtas, they start explaining about a Dhanyamlam. It is very similar to your teacher will be teaching you in Rasabhaishya Kalpana, Kanji. It's a little bit similar, but Sahasra Yogam specifically mentioned the Dhanyamlam. Dhanyamlam minikalpeyet. Ashidi Vadarogeshu Dhanyamlam minikalpeyet. Shubhe Muhurte Nakshatre, etc. Tina, there are so many ingredients are there. So Dhanyamlam is a Ushna, Tikshna, Ruksha liquid you pour on the body. So if you know, if doesn't want that much Ruksha, but you want to have something little other guna. So according to that, you prepare one kashayam. Patient is having severe itching on the body. When you do Dhanyamla, itching can worsens. So you think, okay, this patient is having lot of itching in the body. So I should take Aragudadiganam. You know, the Shodhanadiganam Sangram Yoga, Aragudadiganam. You take the Aragudadiganam, Kashaya, you pour all over the body. That is also called Kaya Sekam. So that is with the Kashaya or with the Trifala Kashaya. That is also acceptable. Then you think, oh no, it's not Kashayam. I want little Snigdha, but not like oil. You take milk, you add something. Patient is saying having severe pain in the joint. So you can take milk in the Vadarektam. This is Dashamula Shuddha Kshiram, Sadishula Nivaranam. Dashamula Shuddham Kshiram. You take Dashamula, boil around, take 3 liters of milk added with that Dashamula, and you do whole body with the Dashamula milk. That's called Kshiradhara on the body. Or if you want a little more guru, like oil, then it's called Pankaj. So what you have is an extreme Ruksha and to an extreme Snigdha diet. Again, the Kriyakramam has some guna which are applicable. The material what you use is also have some guna. So that's what I want to say, that which treatment is for which disease. It's not based on disease. It's based on the avastha of the disease. If ama avastha is there in a rheumatoid arthritis patient, there is a severe ama avastha is there where you are expected to do any ruksha, ikshna, tikshna, then Dhanyamala Dhara can be fit there. But again, the same patient after few days, Dhanyamala Dhara cannot be fit. Rather, Kshira Dhara may be better. Again, in the same patient, later on, a Kayasekam Pirichil can be better. So that avastha, is that state of disease become very, very crucial. Are you able to follow me? Okay, so whenever we look into the treatment therapies, it's like a gradation of something. From extreme Ruksha to extreme Snigdha, extreme Ushna to Shita. So extreme Ruksha to Snigdha, extreme Ushna to extreme Tikshna, like that. Then, sir, can we do some mistakes in between? Yes, it is also possible. When you start some Dhanyamala Dhara, sometime condition worsens. That means if you Vashayana Vishayabhyam Parikshana, like that also possible there. What the beauty is that it's not that a disease, it's not that a particular naming of the disease makes the treatment yogya. Rather, particular avastha is there. That makes the therapy very much suitable for certain period of time. Very, very certain period of time. So that is the Dhanyamala Dhara or Kashaya Dhara, whatever. They are excellent. As I told you before, not only milk, if you want to do little Ruksha in between Dhanyamala to Kashaya Dhara, you can do with buttermilk. We used to do Takradhara, Amalaki Musta, instead of Amalaki Musta, you take Aragadadiganam, you take other Nimbadiganam, you prepare Kashaya, and whole Takra is mixed. Do all over body. It may be a skin manifestation. You get very good result. The idea is that you try to understand what the pathology and accordingly you choose the treatment. And it mobilizes. So here it is Snehana and Swedana together. Because when you are using oil, shall we start? 5 minutes. Yes, I'll keep on speaking. Oh, sure. Then I'll just complete these few more slides. Then we'll have pause. So we have Snehana and Swedana together. That means we have Dhara Swedanam, Drava Sweda is there. Here we can use different type of liquids. It can be Dhanyamala, it can be Kashaya, it can be Takra, it can be Chira, it can be oil, even it can be Kridam, provided we should need that much quantity. So many things can be used, but based on the guna which comes in the scale. It can be done. You see the picture here. You see how the therapists are sitting in the floor? How tough it will be, sitting in the floor and doing the therapies. These type of traditions are there from many, many years, practicing Ayurveda in the floor. So what we need is we need liquid. It may be medicated thylam. We may give some Gandharvastadi Kashayam to the patient if at all needed to have a Dibana Padana Avastha and Anulomanatvam. We need a cloth, vessel, stove and pillow. Then we may use some Dasnadi Churna for the talam, like that. And now we'll start the procedure after a break. We'll start the procedure parallelly. When the procedure starts parallelly, I'll be keeping on continuing the slides. Is it okay? Thank you.